Welcome to Health System CIO's interview with Jason Joseph, Chief Digital and Information Officer with Corewell Health. I'm Anthony Guerra, founder and editor-in-chief. Jason, thanks for joining me.
Thanks, Anthony, for having me.
All right, excellent. Looking forward to having a fun chat. Jason, you want to start off by telling me a little bit about your organization and your role?
Yeah, absolutely. I'm the Chief Digital and Information Officer for Corewell Health, and Corewell is really the byproduct of several health systems coming together over the last few years. Lakeland Health, Spectrum Health, and Beaumont Health, all in the state of Michigan, and we also have a health plan, Priority Health. Across all of that, we have 22 hospitals, about 65,000 employees, 1.4 million health plan members. And we cover a good chunk of the state of Michigan, and we have a presence also in Indiana and Ohio at the moment with our health plan. So really a powerhouse in the state of Michigan and eking into a regional presence as well.
All right, very good. So I reached out to you today. You had a LinkedIn post up. You mentioned your AI Center of Excellence.
Sure.
So I thought I'd catch up with you, learn more about sort of what that's about, how it evolved, why it was put together, some of the reasons. That's always interesting, the impetus, the reasons that drove the creation of something. Usually, we either want to do something better or something is growing in ways that we're not sure of, and we want to get our arms around it. And I think from an IT point of view, that can be why some things are developed. Users probably have a tendency to do and leverage things that they can. And then perhaps from an enterprise IT point of view, we see things happening and we say, okay, we need to put some structure around that. Let's come up with something. So I don't know if that was part of it, but you tell me about the AI Center of Excellence.
We've been through a pretty large integration, and a part of our strategy for the last few years has really been combining all of our core systems. So we started with, kind of the foundational infrastructure, cybersecurity platforms, our enterprise systems, Microsoft 365, Workday, ERP, ServiceNow types of things, and then also integrated our Epic instances and 150 of our other ancillary clinical systems all over a span of about 2 years. And that was all happening really to bring our system together as one. We really believe in the power of that integration and our ability to kind of come together and bring the best of each of our regions together to provide a higher level of quality. And because of our health plans involvement, we also have this ability to kind of span the gamut for care and coverage. When ChatGPT kind of rocked the world, it's been around for a while, but when it kind of hit the news in 2022, we're in the middle of all of this. And we actually have a reasonably structured process for bringing on new technologies and preventing kind of that tech sprawl and
Hmm.
shadow things from happening. But we also wanted to make sure that we had our arms around it and could direct people in the right way to think about this. So we established the AI COE pretty early. And when we first established it, it was kind of a loose collection of people who were interested in AI and technology innovation, including some of our physicians, some people from compliance, people from our technology groups, and just a gamut of things. As that started to spin up, what we found is it was a place where people would go to get ideas or to bounce ideas. It wasn't very formal. We
Hmm.
wound up structuring that more formally as we hired somebody with a focus on AI. So we have a director now in our organization that really has our advanced analytics and AI services and manages those, and also kind of chairs that AI COE. But the AI COE is an org structure. It's really a governance structure to make sure that we're on the rails from an evaluation. We have some processes in place to evaluate AI. But we believe pretty strongly that AI isn't a thing that a group is going to do. It's really going to be interjected everywhere. It's going to be part of our core applications and our platforms. It's going to be in the world around us, just services we use and consume. And it's going to be some things that we do build and drive solutions with, whether that's generative AI technology or kind of the more predictive analytics types of things, and things that may involve cameras and video and image-based AI recognition. So there's a lot of different things under the umbrella of AI that we want to make sure that we've got our arms around. And the AI COE was really formed with a team of people who were either experts or would become experts to help guide those efforts. But we were very explicit in saying, look, it's kind of like a security review where we're helping set the standards and drive it forward and make sure that we're on the rails. It's not the team that goes and does all the AI. This is really just a group that comes around and says, hey, we've got something we want to do with AI. Our AI COE provides the framework, the guidance, the checks and balances, the compliance verification, to make sure that that team actually doing the execution meets the guidelines and has a plan for things like verification of ethics and validation of models and those kind of things, which are typically not in the skill set of somebody who's like, hey, I just want to make a business process better.
Right, right. Um, do you see it possibly, I mean, probably people could do this any number of ways, and this is everyone realizes you gotta get your arms around it, right? You can't have everybody all over the place doing all kinds of stuff. We need to put some structure around it. You've selected sort of this approach. I would imagine there are other approaches that people could take.
There are. I mean, I've heard of places, hiring a, chief AI officer and kind of
Sure.
building teams, and then they kind of govern it. Other places that do it similar to this is kind of like an oversight. And some other places that maybe are a hybrid of the two, where you've kind of got a centralized group and then maybe some federated services around, advanced analytics, which is a little different than building a, chat bot with Gen AI type capabilities underpinning it. So I don't know that we have the right model. We have formed it. We mostly hold the belief that when you've got disruptive technologies like this, creating like a center that like is going to try to own everything related to those things is really short-sighted, right? I've
Mhm.
heard the analogy. It's kind of like electricity. It'll just be in everything and make everything work differently.
Mm.
And I imagine back in the Industrial Revolution, there was like a chief electricity officer, who was trying to figure that out.
Right.
But then later you're kind of like, well, that seems silly. You just need the plant manager and the operations people to know how to rethink the way you manufacture with electricity and the logistics team to figure out how to do it with, powered steam cars and not horses. Like those types of tech innovations, and we believe AI is one of them, are better shepherded by, yes, having a strategy on how you're going to deploy it. But that strategy isn't do this, and
Mm.
this project. We're not going to know. And so the people closest to the innovation itself are the ones who are going to figure out how to harness that. And we want to be able to educate them, support them, and allow them to work with the teams they already work with to implement other technologies, because that's really the workflow. I'll give you a good example of that, right? We implemented a Bridge, which is a ambient listening AI tool set uh, in a pilot form. And we had that within our informatics team and within our core clinical systems team supporting that from day one. Why? Because it's in the workflow of the clinician. It's on the same set of technology. It has to interface with all those devices. If that thing comes in from left field with a bunch of people who maybe know AI but don't know anything about clinical workflow, it's not going to be optimized. It's not going to work. And so we want that to be as close to the people that are actually implementing the rest of the technologies. A, they're excited about it. B, they know the workflows. And C, they can help guide the things that are like, hey, you're chasing the wrong thing here. That's not really going to make a difference. So that's our model. And we kind of apply that regardless of the technology. We took the same approach with digital, right? Digital wasn't a thing off to the side. It was just the reinvention of the way we communicated and accessed and provided technology in the palm of people's hands. So that's kind of our philosophy. I know of people that are doing it differently, and we'll see kind of in the long run which thing works better. I would argue to some extent having an approach in doing something is more important than doing it exactly right.
It's just this is all blowing my mind in the sense that as you're talking, you're making a tremendous amount of sense, right? So there's this concept that you mentioned that the I like the electricity analogy that AI is in everything. And then I'm like, "Oh yeah, well, I guess kind of innovation is kind of in everything too, right?" So why are we pulling out innovation? Why are we pulling out AI? And then digital, right? Again, digital's in everything, innovation's in everything, AI's in everything. So you've got this alphabet soup of titles. Everyone's doing it differently, which may be okay. I guess some things make a lot of one of the things that makes a lot of sense to me as I talk to people is the intricate relationship between AI and data, right? Right. So I've seen chief AI and data officer. I'm like,
Yeah,
okay, that kind of makes sense, right? Because AI rests on works off of data. So you could have the most beautiful algorithms, but if they're working on poor data, not very
yeah.
good. So any more of your thoughts there again about you know these ideas, these areas that you could sort of move over here, you could move it over there. How much
Yeah.
does it matter? Maybe it just depends on the personnel and the people.
Well, that your point, let's just unpack what you just said about the AI, right? AI, absolutely. It's very important to think about data. We have a integrated data and analytics team. So we have a kind of a head of that group, a senior vice president. This director, I said, that kind of shepherds
Yeah.
our AI COE actually reports into that group because of the data connection. Here's the interesting thing. Most healthcare organizations, if you go say, who's the head of your data team? They're going to tell you who's the head of their data warehousing and analytics data team, who's building data products on mostly structured data or unstructured data that they pulled out to pull into other things, right? So, yeah, I pull out the notes and I pull it into a data lake so I can do something analytically with it. When you think about the workflows in AI, and I'll just use kind of this new agentic AI thing,
Mhm.
right?
Yeah.
So replacing that front end bot that everybody kind of knows kind of sucks and you have high expectation and then it's like it's actually the dumbest thing ever, can't do anything, and then I just say agent, agent, agent.
Yeah.
But there are bots that are getting very good because they're built on GPT, they're trained on your data. When we talk about training on your data, it's not the same. It's a lot of times it's like, no, go pull all the unstructured documents off of my intranet. Go pull my customer support manuals. They're in document form, they're elsewhere. Most of those chief data officer types are like, oh, that's not the data I need.
Hmm.
Oh, it is the data we need for some of these use cases. And so this definition of what data we have, it actually gets a little bit broader than what has been in practice in the past, right? I'm less worried now about pointing that bot at my structured list of all my inventory metrics, and I'm more interested in pointing it at the help desk articles that describes how to go out and enroll a new member in our health plan because I want to create some self-service out of it. So the paradigm for like when we talk about data is changing. And when you think about it that way, okay, we're building new tools with AI embedded, it feels more like an automation engineer or a software developer than a data engineer whose tool sets is usually, hey, I know SQL, I know programming language, I might know Python, and I've built a lot of things in Tableau in data tools. This isn't that, right? This is workflow automation. It looks different. It's like software development plus scripting plus automation plus knowledge of your business. And
Mm.
a lot of the tools to manipulate and use AI aren't highly technical, right? You're not building a large language model with data science. You're training a model to behave a certain way based on content. You're teaching it. It's like almost a teacher skill. And so I think that to understand the problem you're trying to solve and then how you're going to go about solving that and then getting the right people oriented around that is really important. So for us, thinking about who will build that tool set really makes more sense in our automation team, right? Not in our data science team,
Mm-hmm.
even though the data is fundamentally important. So that's kind of how we think about it. Is I just have a general philosophy like the people closest to the work that has they should be able to do as much as possible. The more you abstract that and make this like the central ivory tower of knowledge, the less relevant it can actually become. You need some of that because with the new technology, you need the guardrails, right? Don't electrocute yourself. Don't plug this into don't put your electricity underwater. Some good things. AI has the same things, but those are uh, kind of like your security team. They're keeping you safe by giving you what not to do. They can't just keep you safe because ultimately security is up to all of us to follow the rules. And I think AI is similar. And the organizations that are going to be the most successful are going to empower people within guardrails and a framework to build AI into each of their roadmaps of what they're trying to do, because AI should apply everywhere. It applies in the clinical systems, it applies to our customer facing systems, it applies in our call centers, it applies in our back office, right? That isn't something that you can just say, this team does all of that, they just won't know how to do it. So I don't know if that answers the
Uh,
question you're asking, but that's kind of our thinking behind it.
No, I mean, what you said is really, really interesting and makes a lot of sense. This concept that generative AI has fundamentally changed the relationship between an individual and information.
Correct.
Is fundamentally changed that,
And
and it
how you go about getting it. It's
yes,
almost like the new, the iPhone changed the way you interacted with everything in your mobile device. This is going to change the way you interact with information, right? It used
yes,
to be dashboards and lists, and now I just ask a human question. But
right, right.
that's a mental leap.
It's a big one. It's a
Yeah,
huge one. And when you talk about empowerment, and I completely agree with you about putting the use cases in the hands of the users, meaning you know the problems you're having, right? You know the workflow issues, but it could be when we talk about empowerment, that seems to me education of the possible, right? So for example, hey, users on the front lines, I don't know what you're dealing with, but I want you to know what this new stuff can do, and I want you to play with it and under safe guardrails and all that. I want you to see if you can solve some of your problems. And here's how you use this stuff. And here's some examples of things it can do. And then you let those flowers bloom.
yeah. The one one clarification I will give you. We've done that. We've rolled out kind of an enterprise GPT that's private and safe to allow people to do that and get it. But then there's the workflow specific items. Hey, I've got an AI tool to help me interpret images in radiology better, as an example. They exist. We want to implement those things. We still have an IT related technology team and informaticists to support radiology. That's the team that's going to help the Department of Radiology with this workflow. So I'm not as democratic maybe as like just handing all the tools over to the Department of Radiology and saying, go knock yourself out, because there is still an implementation. It looks like any other system though to me. It looks
Okay.
like, okay, we've got your PAC system and all the workflow around it. How do we integrate these AI capabilities into a workflow the way it needs to be? We'll partner on that. So it's still one part technical expert, one part user, good governance and all of that stuff. And then the AI COE provides that extra layer of making sure that as you're doing this with the AI pieces, I don't need to be an expert in AI in my IT department supporting radiology. I need to be an expert in technology implementation and workflow for radiology. The AI pieces, I'm going to understand the workflow needs. I can draw on an expert who can help me validate the model, because I
Hmm.
don't know how to validate an AI model, but
Hmm.
we have experts in data science that do and can show how that's done and help with those components. So that's kind of the way we think about this, but putting that capability and getting everybody educated, you're exactly right. It starts with your tech people to know what the art of possible is, right? And there are
Right.
so many disruptions that AI is going to bring. We can't imagine them all yet, but we have to start thinking about each of the areas that we're in is going to have go through a process of disrupting itself to take advantage of it in some way, shape, or form.
Right. You mentioned imaging, and this is where discussion can come up around what type of AI you need for the type of problem you have or the issue you're trying to address. Traditional AI has been called machine learning.
Yep.
And then again, I'm going to tell you my understanding of things and you can clear things up for me, but that's where we talk about detecting an issue in an image. These are very specific yes, no, black, white, specific answer, as opposed to generative AI, which is here's a zillion documents, give me the highlights, and it can do that in 30 seconds. It's wonderful and amazing, or create content and all that kind of thing. And then agentic AI, which we're sort of on the cusp of people really starting to roll out, where theoretically you can not only give you information but do things for you in a multi-step process. Um, what are your thoughts about that concept of using the right AI tool for the right job?
I mean, that's exactly it, right? I mean, in the radiology use case, you got to train on a bunch of data and use computer vision to say, highlight it. It's a 92% chance that this is blah, blah, blah. There still is a human interpretation. At some point, that particular case will get to the point where it's like, look, we've had a million studies go through this thing, and been so low that the human error rate far exceeds it. We're just going to automate this thing. Let it just decide. EKGs, like cardiac, EKGs, those are easily detectable for arrhythmias and those kind of things. By heck, it's on your watch, let alone a 12 lead, right? So many of these processes are still stuck in regulatory land, where it's like actually the computer does this as good as the provider can, but we still can't quite get to the full efficiencies because we want that overread, we want that view. And that's going to be that way for a while. I mean, heck, self-driving cars, I still got to keep your eyes on the road or touch the steering wheel every once in a while. You can't yet take a nap. And I think we're going to be in that world for quite a while with these things. But you're making the point about the different types of AI. It is the right tool for the job and it's the right process for the problem, right? So innovation, and you talked about innovation. Innovation isn't, to me, a team that does innovation. Innovation is a process that connects problems that we need to solve that are unsolvable, because there's a lot of problems we need to solve. We just haven't solved yet. We get
Right.
this all the time. I want to bring in this tool to do this thing because of whatever. And we're like, actually, Epic can do that. It's like, well, yeah, but Epic will take us too long to implement. It's like, no, that's not innovation. That's just going off of our roadmap, right? The strategy is Epic. We put that on our implementation, and yes, we'll get to it eventually. The problem that we have that is unsolvable, and the tool set that can actually solve an unsolvable problem. That's where the space of innovation lives. And that space is not a team. It's not the expertise of a few individuals. It has to be everywhere. But you do need some people that can help connect those things for you, because the people knowing the unsolvable problems don't always know the possibilities. And the people who know all the possibilities, your ventures group and everything else, don't usually know what the unsolvable problems are. And so there is some work to connect those things. But once you do, that's really where you should start doing those experiments, right? Okay, unsolvable problem, potential solution. Does this actually solve the problem or not? Then you can get into it. And AI is not that different, right? It's, I've got an unsolvable problem. How do we apply AI? I do think the one challenge AI brings with it is we still aren't creative enough to get out of the solvable problem. So what we think about AI is a better way to do the thing we're already doing, instead of a different way to do it in a way that we couldn't contemplate before. So, a lot of people will take AI and say, I want a better chatbot. Okay, I got chatbot, I got better chatbot. What if you didn't need a chatbot? And what if you just had something that automatically looked at all the stuff and suggested what you needed for you, and then better yet, took action on it? And so we're just at the cusp of this right now, but I think in
Mhm.
the near future, you're going to start to see things that we couldn't imagine were even possible or didn't know were possible become possible, because AI is really good at kind of thinking beyond the bounds of where we are as humans.
Excellent. Great stuff. I love that. Let's talk about this idea of human in the loop.
Yeah.
And you use the term full efficiency. So here's how I'll lay this out. 99% of the people that you will hear talking about this, especially on the clinical side, will always talk about, don't worry, a human's in a loop. Don't worry, a human's in the loop. As if, that's critical, it's never going to go away. And maybe it will, maybe it won't in certain areas. You're one of the few people, and I heard another CIO say this, that he doesn't like the term human in the loop. It bothers him. It's limiting, right? It's not scalable. So whenever you talk about a human in the loop, he gets a little disappointed. And that's what you're saying. It's a little disappointing. You
Well,
see,
I think
we've got this sort of people who are looking at it one way, like human in the loop is a problem, and we've got everybody else which is saying human in the loop is the only way, or people will never be able to mentally deal with this. What are
I
your
think
thoughts?
I think it's a matter of timing, right? I mean, there are many things that happen today that don't need a human in a loop because they're so accurate, and the risk of inaccuracy is low, right? My watch does a bunch of those things, low risk, highly accurate. What's the big deal? I think where the human in the loop matters is where there's really big things at
Hmm.
stake, lives and misdiagnosis, and the accuracy doesn't approach 100%, right? So in those cases, yeah, you still have to have it. Self-driving cars are a good example, but at some point you actually look at it and you say, the machine is 99.7% accurate, the human is 98% accurate.
Right, right, right.
And when, as a society, are we going to be okay letting the machine do that? Because they're actually better than your idiot, neighbor driving who's going to run into you, right? But I'd rather have my idiot neighbor hit me than a robot car, right? And so for some reason, we as a society still like need that as a comfort
Yeah,
zone. So part of this is comfort, part of it is the level of risk associated and the level of accuracy. And I think right now, the data will show a robot or a human can be accurate. Either one independently is an ideal, but the two of them together actually get you the best result. And so I think that's why right now human in the loop is the right answer for many things. What I'm saying is that at some point, when we prove that the robot side gets to near 100% accuracy and the human isn't there, what's the human in the loop doing now? Checking the box over and over and over, right? It doesn't really make any sense to have the human. We got to get comfortable saying, yeah, we have an entire person there checking the box. They never don't check the box. They're so good they built a robot to check the box for them.
yeah,
It's you got to have to say, all right, can we just make that automate it, fully automate? So
yeah. It's interesting, right? We're at the point where we talk about informing patients of the use of AI, as if they would somehow balk at it. But I feel like fairly soon we're going to get to the point where people are not going to want care from you if you're not using AI,
yeah.
right? I mean, that happens
Especially if it's not
quick.
helping. Yeah, I mean, it sounds scary. Oh, I don't want AI doing it. It's like, well, what if your doctor is wrong, which medical errors happen all the time? Wouldn't
Mhm.
you want a second set of eyes on everything?
Absolutely.
Like, of
Abs
course you would answer it that way. But, when you talk, there's still this fear that it's the robot and then and there is a behavioral thing here, I will say. Like, it sounds great to have a human in the loop all the time, but when the robots get really, really good and automation gets good, something happens in the human mind. They don't actually check it anymore,
Right.
right? Even if they are in the loop, at some point they mentally check out and they're like, what?
100%.
Why am I even bothering? So we have to recognize as a society that that could be a false sense of security, where we think we have a human in the loop and they're actually not.
Oh, that's a good point. That's a great point. I still miss things sometimes in my checklist that I use, and I'm like, "It's a freaking checklist. How do I miss stuff on it?"
Yeah,
Because
because
you do it so many times, you
it's
go,
so
"Oh, I've
many times.
skipped
Correct.
that."
You skip that because you're like, it's never not been there. So,
Right.
it's kind of like you have to get a pilot mentality. Like they check everything regardless of whether they've ever had it go wrong because it's drilled into them. We'll probably have to get to that point at some point. So.
Because of the risk you said, right? The risk
Yeah,
of
for the
missing
risk. The
something.
the risks of it are too high,
Yeah.
and there is enough possibility of error that if you're not in the loop and that error happens, right? We
Mhm.
don't have a tolerance for that as a society, right?
No.
Yeah, people make a mistake all the time. A self-driving car crashes into a group of pedestrians, it's front page news.
Yes.
And it's just kind of the way it is. And so even if you can cite the stats that, yeah, but that car is 99.9% hasn't run into a pedestrian and your buddy Frank over there hit somebody yesterday. I don't care. I want that to be 100%. So I just think that's more of a societal norm
Yeah.
question where the comfort level, but the pressures of healthcare and the financial pressures and the labor pressures, not having enough people to do the work, I think are going to bring this to a bubbling forefront because we're going to say, look, we could go further. We could make this easier and less costly, but it would require us to take on a little bit of risk.
Mhm.
And, and maybe it's not even real risk, it's perceived risk.
Right.
As you go through that, I think that's going to be what we're going to have to wrestle with as healthcare organizations, say, how far can we push that? Can I actually take that human out of the loop and save that efficiency and redeploy that elsewhere? Or do I need somebody in there because we've got a rule or a regulation that says it's there? Those are the things.
Great stuff, Jason. Let me ask you one final question, then I'm gonna let you go. Um, advice to people in your position. Um, I would assume, you've got this center of excellence for AI. It gives you some level of comfort as an IT leader. You want to have a feeling that things are under control to some degree. What would your advice be? I mean, how do you know if things are not under control? I mean, any red flags here? Again, an eye to your colleagues, sort of, hey, like this is the minimum you need to make sure everything's all right, or if these things are happening, you're not in a good place. Any final advice there?
Yeah, I think I don't know if you ever feel like you're totally under control, so that might be the myth. But I think the bare minimum in this case is both on the risk and the reward side, right? If you're not doing anything, I'd be more nervous about that, like
Mhm,
because if you're so worried about the risk, you're not experimenting, like you're going to get left behind pretty quickly. The pace is moving. So there's one side of like we have to do things. And then the other side is like, how do I mitigate the risk of doing things so I don't hurt somebody or do something? And so I think around that guardrail side, you do need a policy. You do need to make sure that people can't use AI in a certain way, in an inappropriate way. Like those are things you put in place. You can't use Chat GPT externally and bring that in and use it in patient care diagnosis. Like set some rules and some guardrails, and then have some guardrails that you apply to your entire organization about how you implement, what are the requirements. And you can find some of that stuff honestly generally available. There's some societies for around the good and stable use of AI,
mhm,
different groups that have created some of this content. So you don't need to invent it on your own, but adopting some of those things and then making sure you have a team that really can get educated and up to speed on those things and help you stay within those guardrails. I think that's kind of where we're at right now. But it's
mhm,
both a try something and find a way to expand this. I would just say one other thing. It's not about the AI COE. Like that is a piece of this puzzle.
mhm,
What we're
mhm,
really talking about is what is your approach to AI as an enterprise? That's the
mhm,
thing you got to figure out.
mhm,
AI COE is definitely a part of it, and I think everybody should have some form of this, whether it's highly centralized or more of a guardrail organization. But the question is, how are you going to market with this, and how are you bringing your teams along? That's the question everybody's wrestling with. I would say if you're doing everything and you're not running it through with filters and you're not getting things to bounce to you once in a while as like a flag, hey, we're not sure this is okay. Well, then maybe you don't have enough guardrails. And if
mhm.
you're seeing, a lot of those things happen, or you're just not seeing activity at all with AI, that would also be cause for worry in my world.
Jason, this was awesome. I loved it. I really enjoyed it. It's going to be great for our readers.
Yep.
I want to thank you so much for your time today, and I hope I can catch up with you down the road.
Absolutely. Really enjoy the conversation. Thanks, Anthony.
Have a great day.
Take care, you too.